opportunity there. The next kind of key thing, I think, was about reducing errors a little bit, but it was also really about clarifying some of the really detailed legal nuance around the Mental Health Act. There are a huge number of potential options available to people, but they're sometimes not clear, and it can sometimes be confusing as to what's supposed to happen when. And so there would be a potential there to have a kind of digital reference as to what the options are in a given situation, particularly in an unexpected situation. So those were the positives, and then there was a little bit on kind of data for learning and training and quality improvement purposes, and there was also a big thing about access to notes. So being able to share across institutional boundaries within a region, specifically within a region, because you're presented with people and it's very difficult to access the notes and know what that person may have said to somebody else in the past. So they were the positives about digitisation. I think the worries were quite aptly demonstrated by one of our guests struggling to stay in the room and dropping out. Access was the biggest concern. So if you move to digital, are you leaving already vulnerable people behind? They may not have access to devices. These scenarios may be outside of signal and internet range. People don't have access to laptops, etc., etc. So you could completely, potentially disengage people who are already on the fringe, and I think that was very important. We touched briefly on video assessments, which was not the full focus of this really, but it's felt that that was potentially a kind of dehumanizing aspect, and I suppose that was the risk, to try and use the technology to make it more human, not less. So in order to do that, you have to be very mindful of the risks of people not having access or not being able to do it. So I think, in a very quick summary, reading my notes, I believe and consistency. So if you are going to digitize something, it does need to be consistent.
Is that consistency?
Yes.
Yeah.
I hope
okay.
my group feel that I summed that up. Okay.
Brilliant. Thank you. 16 seconds over 4 minutes, Arden. So
I'm sorry.
No, it's very good. That's all right. So thank you for that, and thank you for that group's deliberations. We're going to come to Geraldine next. Are you ready, Geraldine? You just need to unmute and give your group's feedback.
Oh, sorry.
That's fine. That's brilliant.
Can you hear me?
Yes, we can, when you're ready.
Brilliant. Okay.
Thank you.
Nutshell.
Ah, she's gone mute again. Geraldine, you've muted again. Can you unmute?
Take someone else.
Do you want us to come back to you in a minute?
Okay, it's fine. That's it. Perfect.
You're good. Good to go.
Apologies. So I have 3 minutes now. So we were incredibly lucky in our group. We had expert staff experience. We had a nurse consultant working in older adult services with people with dementia. We had policymakers and we had CQC regulators. So we had a great group of people. And the main points raised in our group, and colleagues on the phone, please tell me if I not fed back properly from you, is everyone wanted swifter, better, more efficient processes. Everyone was concerned with the fact that it's sometimes very difficult to get the paper and the communication. And it wasn't just that the paperwork is legal, it's also that the paperwork contained vital information about what the purpose of the detention and the purpose of any admission was. And then often the paperwork and the information was not conveyed sufficiently to the care team who the person was going to. that people could arrive, for example, in an inpatient ward without actually there might be pieces of pink paper, but they didn't actually give the information about what was the appropriate treatment that people were going to have when they got there. And slightly paraphrasing, I would say the second big issue for people was about collecting the digital information in a way that means you can use it for data quality improvements. We know, for example, that many face-to-face paperwork systems have no more than 20% accurate recording of nearest relative. So therefore, you can't have a rights-based legal process if that vital information is not conveyed. So that was just one example of data quality. The next big issue was trying to think, what can we do? Can digital help with the wonderful access to social media and others to help people recognize that detaining someone is a huge issue for people? It's not a little thing. It's not a standard thing that happens in people's lives. So how can we use the power of digital to almost get people to think again about this is really something that needs a really proper considered decision? The next thing, and I think a lot of the focus in our discussion was about the advanced decisions, advanced directives, shared decision making. Fascinatingly useful, helpful discussion with people saying what are the big issues with advanced decisions is how do you make them accessible in terms of the English in them and who writes them? Can they be first person singular? Can they include relapse prevention plans so that people stop that kind of awful cycle of detention that happens for people? Can we learn from other fields? So our colleague who works in older adult services was saying that people with dementia sometimes have an advanced decision, but it's not actually easy to access. So it's not often brought with the person. Another colleague mentioned that the Motor Neuron Society have good advanced decisions. We were able to feed in very, very simple shared decisions, safety plans, relapse prevention plans from the west of Northern Ireland, where it's been a real bottom-up process of design. It made all of us think about is one way to help improve this is that those of us, whether our own decisions about our lives is about the use of the Mental Health Act or whether it's actually about our life in general. And I was saying, I personally have an advanced decision about if something happens X to me, I want Y to happen. The next issue was, can it really be legal? Can it actually, if you have an advanced decision, what is the power of that? So in summary, our group felt that there was a lot of potential to actually get the processes right, to think about it a bit more, and digital could help with that and could certainly help with some of the communication. The very big issue, as with the last group, was what about all the people who are either digitally excluded or perhaps where their language, they speak a different language. So these kinds of things, understanding their rights, being provided with information that's in a language, in perhaps a digital form that makes it easy for people to understand, seems really, really important. So it's great discussion. We could have gone on for the next 2 hours.
Thank you, Geraldine. That's a lovely summary of your discussion. So I'm going to move to Steve next. Steve, would you like to share a little bit about what happened in your group?
Yeah, so we had a self-described former service user who now works in social work and is transitioning into the mental health field. We have a veteran mental health lawyer who first started working under the 59 Act. And then we have a qualified RMN, registered mental nurse, and she now describes herself as being the bridge between kind of the administrative part of the Mental Health Act and more of the front line with professionals and service users. We had a really good discussion. But there was a bit of a split over the first question. So we had elimination of errors. Putting the lawyer on the spot here, he said that they were all equally important, but it gave a really good rationale for that. But even in these other discussions that we're having, we need to make sure that we don't create a hierarchy of what's important, because the things that hit the bottom will always kind of suffer and get less time. And we also had the importance of shared decision making, and that often it's felt that gets missed at the moment. We had quite a lot of discussion about accuracy, and especially on paper, that it's not, notes are not always accurate, and actually being really mindful that we don't just kind of carry that error over to digital, and might digital make it more challenging for people to say that my notes aren't correct here. We spoke about the fact that the Mental Health Act process involves lots of different parties, that it's very, very, there's a lot of complexity to it, and that it's made up of lots of little decisions. So how are we recording that, and how are we making sure that in digitizing the process we don't oversimplify it and lose some of that nuance? Really good discussion about the fact that actually culture is a really key issue here, and that's certainly something that came out during the Mental Health Act review in itself. Fundamentally, we're looking at parts of the law in that review, but actually culture was a huge issue. Hence, 70% of the recommendations are nothing to do with the law, and in fact, they're to do with practice and to do with culture. So how do we deal with that? Concerns about things like the AMP report, which are not a statutory document. They contain vital information, which then can get disregarded when a patient moves into hospital. Shared decision making is massively important, and again, that links to culture. How do we make sure that a digital process isn't somebody having something done to them? And then, kind of in relation to question 2, there was the viewpoint put forward that actually the Mental Health Act shouldn't be under a medical model at all. It should be under a social model. Some further comments, real concern about GDPR being misused, and especially where a person lacks capacity. Concern that there are a number of digital solutions out there. So, how do we get that balance right between kind of having a monopoly, but also not having that many products out there that it becomes difficult for people to know what they should be doing? And I just want to give a big thank you to my team. It's not a competition, but I think we definitely won.
Okay, thanks, Steve. So we're going to move to Carla's group next. And Carla, you're going to, if you could start with question 2, and particularly, I don't want to disenfranchise your group, but if there are things that have already been said, if you could say things that haven't already been said, that would be really helpful. Thanks.
Absolutely. I just want to give Steve's group a go as well. So we've had a brilliant group. So we were small but perfect. So in our group, we had Becky, who's also leading at NHS on the digitalisation of the Mental Health Act programme. And then we had Peter, who's a consultant psychiatrist at Hackney, and they're also kind of looking at at a pilot currently at digitalisation of the process. And then we had Sue, who is a social worker up in Rochdale and also approved mental health professional. So we started with question 2, and that's kind of mostly where our conversation was, mostly because, there are already people kind of leading it and people piloting it. So we wanted to really just kind of really reflect on some of the concerns and the risks that we think goes with this. So first, in terms of a conversation we had around that, it does feel that with the using the digitisation, that it becomes less personal, that the person is kind of taken out of that process. We had a conversation where we kind of looked at being clear that there's 2 parts to it. The part around the actual remote video assessment, kind of process, and then the other part around looking at the flow and the process of the kind of Mental Health Act assessment, and wider even kind of the application of the Mental Health Act. And I think there was a feeling in the group that there was more concerns about the actual using of video assessments, feeling that, you know, traditionally the kind of coming around the use, you know, coming around in a circle, you know, during the Mental Health Act assessment, and the use of forms actually bring people together, although we kind of started to debate that as well, feeling that, you know, as Peter said, that, you know, sometimes you don't actually just sit together and kind of write out a ping form. You do go off into your kind of separate areas to try and find a flat surface somewhere to kind of write out those forms. We felt that in terms of information sharing and kind of the whole information governance, it's normally quite a complex process across kind of public sector, and had concerns, you know, about how that will be kind of spread across kind of nationally in terms of information sharing. And then we kind of looked at the interface that there are with the local authority, and where AMPs act on behalf of local authorities, and that in a number of kind of councils, they don't have the technology to perhaps support these processes. So for example, the AMP that was within our group, and it's not unusual because I'm aware that that is across a number of councils, where a number of AMPs don't have access to a smartphone, for example, where I think up till very recently in her area, AMPs were writing not just the ping forms, but also the AMP report per hand or by hand. And concerns about, you know, using kind of technology if the internet access isn't kind of viable or strong, or it kind of drops, and also touched a little bit on concerns of using kind of perhaps a tablet when you're sitting on your own in a car, worrying that there would be some kind of security issues around that, and yeah, feeling quite exposed in terms of kind of, you know, that there's not always the right environment, particularly in community assessments, the right environment to always use technology. And then...
You can finish up, Carla.
Yeah, I think that is kind of a summary. I hope the group's fine with that. Yeah.
Thank you so much. That's brilliant. I love the visualization of someone in their car on their tablet worrying about the safety of what they're communicating. Okay, I'll move to Guy. Last but not least, Guy. So you again started with question 2. What were the highlights of your discussion in, if you can keep it under 4 minutes, that'd be fantastic.
I can be very quick because I think a lot of it's already been covered, but I think we can, I can summarize it into 5 words, I think. Cost, coordination, access, security, and people. So we were focusing on question 2. Excuse me. We sort of had sort of looked at it from a sort of higher level, I suppose, in terms of, or should have said my group were fantastic. It was Mia, Callum, Sarah, Zakira, sorry about that, who are mental health law manager, psychiatrists, IMHA and AMP respectively.
Thank you.
So we started off talking about cost and coordination. So how much is digitalising, not just the Mental Health Act, but digitalising generally going to cost, and how is that going to be coordinated between all the stakeholder groups and people? An example was given of a large NHS trust where there are 5 CCGs, maybe different local authorities. That's certainly the case in our trust as well. Then we thought, we had a bit of a debate about access and a sense that at the moment there are lots of impediments to information, accessing information that is needed in order to treat people quicker and safer, and whether or not if there was such coordination that organizations were signed up to the relevant standard. I think it was I think Callum referred to it as 1596, which is a new one on me. That then would improve things. But by the same token, there was a sense that opening up access to information brings with it its own risks, and that brought us on to security and people, and about where do the people who are subject to the Mental Health Act, for instance, where do they fit into all this, and where is their voice? There are a lot of people out there who are feeling very marginalized generally, never mind have they got access to digital technology, and what's their say in how information about them is being stored, accessed and communicated, which is obviously what digitisation of the Mental Health Act is all about. So I think that pretty much sums up what we discussed, and ours was actually the best group.
All the competitiveness. Thank you very much, guys. So thank you all for feeding back in different ways and engaging ways what happened in your groups. I just want to offer the panel a few minutes to reflect on what they've heard from the other groups, but I would like to go to the participants more generally in a little bit to see if there's any questions or comments that they want to make. So does anybody from the panel want to just make an observation about what they've heard in the round in the last sort of 15-20 minutes, and then we can move to the participants.
Can I say something?
Yep. Who's that? Is that Geraldine?
Yeah, I mean,
yep.
I suppose I was kind of really pleased that the whole discussion, a lot of the discussion was about, we know digital can help, but how do we get the right processes and the right standards in place so that digital can then actually help us fly, rather, to be honest, than the other way around.
Thank you. And Steve, yes, sorry, is that Arden? We'll go to Arden, then we'll go to Steve.
Okay, I was actually going to echo what Geraldine said. From my perspective, 6 months ago, we were engaged in quite an academic exercise in discussing whether digitisation was possible. And what I've just witnessed over the last 20 minutes is a total step change in that approach to people saying, okay, it is possible, it is happening, but how do we make sure that we do it correctly? And I think that's a very, very positive message to be hearing. There'll be differences of opinion in how we do it correctly, but it feels that the direction of travel is the right one, which is very positive from my view.
So we're moving from the what and the why to the how, potentially. Okay, Steve, do you want to just make your comment?
Yeah, so I think what I'm hearing is a healthy degree of caution, which is really important, especially coming off the back of 3 months of lots of mental health trusts in particular, and healthcare as a whole, suddenly going, oh yeah, we can do video, everything, video appointments, but we risk that becoming the lowest common denominator of digital. And I think actually this group is starting the discussion around what does that whole process and experience look like. This group is very white. I said it. Again, we know that, again, I know it wasn't deliberate, but it kind of speaks to who is in our easy reach, and when we're having these conversations, how do we start to open this out? And I think, and again, I'm not saying that anybody here in this group has to kind of carry this conversation forward, but for me, this is always a starting point, because I think the one thing that I've heard very, very clearly today is no one should own this. And I think by default, the Mental Health Act is in effect owned by mental health trusts because they're the ones that ultimately look after that person. But they look after that person at that part of the journey. If you look at someone's experiences about what happened before they came into hospital and what happens afterwards, we've got lots of different people involved. So therefore, we need to have lots of different people involved in this conversation, and we need to position this as, actually, this is a community response, and that response will include potentially somebody being in hospital, but it should also include, you know, the right care beforehand. It should include the right alternatives, and it should include the right support afterwards.
Okay, thank you, Steve. Carla or Guy, did you want to make any additional comments before we throw it open?
I just wanted...
Oh, sorry.
Sorry,
so we'll go to Carla first, then you come to you, Guy.
Yeah, I mean, I agree with what everyone has said. There is a healthy sense of caution around kind of proceeding with this. But equally, for me, it's also an issue about parity. You know, within physical health, your doctors can view, for example, copies of your x-rays and whatever, you know, and I just think within mental health, we've got a long way to go, and there's definitely a place for digitisation. For me, it's really about parity and kind of reducing those delays. I mean, having practiced as an AMP previously, you know, I always felt, you know, kind of the stress that people are subjected to the Mental Health Act because it's about waiting for an ambulance, it's waiting to get the information, waiting to get the police, it's just waiting, an accumulation of waiting. So by the time someone is admitted, it may be several hours later or sometimes several days later. And for me, it is about how can we use, that's already been used, you know, within private sector and in kind of physical healthcare, how can we bring that back into for people with you know, mental health needs, and not kind of, you know, dismissing the fact that there are a number of people who don't have access to a digital kind of you know, tools, a number of service users. But how do we as trusts and local authorities and the system work together to enable this and making this happen, really?
Thank you, Carla. Final word from Guy, if you want to, yeah?
Just very quickly, I just wanted to echo what Steve said, and I can remember the CQC having conversations with everybody about how they were very good at looking at what's happening in hospitals, but not very good at looking at what was happening before hospital and looking at what was happening after hospital. And you've seen it in the last few months that I'll give people who are on a CTO, community treatment order, for instance, the first thing that went was the tribunal stopped doing CTO hearings. People who are on a community treatment order, by their very nature, are vulnerable. And yet that was axed. I understand why it was axed, but that was the first thing that went. And then there's been lots of discussion on social media groups, including the one I run, about people who where there's a duty to provide care under Section 117, and that care has been withdrawn because of the lockdown. So I think whilst we're having all these conversations about digitisation and all the rest of it, as my group said, it's opening up a whole wider debate about how digital technology is going to apply to people who are in particularly vulnerable situations, be it through their mental disorder or because of other factors in their life.
Okay, so perhaps if we continue that theme somewhat, Guy, and in reference to what Steve said earlier, and I noticed in the chat box, Akira is talking always a one sentence that really grabs you. Where are the excluded people? So I think that speaks to some of what's been said. And Sakira, did you want to actually make a contribution to this debate, given that you've posted such a great question? Absolutely no obligation, but if you unmute yourself.
Yeah, I have.
Great, thank you.
Just to give some context, I work in Bristol, and I work primarily with service users from a Black and ethnic minority background. So I cover forensic settings, but I also work in an open wards. So I cover quite a large area. And I think this conversation is very much around how professionals going to make, how digitisation is going to make the lives of professionals easier. But at the centre of all of this is that the Mental Health Act takes away people's liberty and their rights, and they should be at the center of this conversation. Where are they? When I find it really upsetting that they are not present in this webinar, and they should have been included. And I want to go back to Steve's comment actually in regards to the BME number, the absence of Black and ethnic minority people in this webinar. Since COVID, my workload, and I've been doing this for 14 years, has tripled. The number of African Caribbean men entering psychiatric settings is just shocking. And carers have been excluded in the process. I mean, parents are asking services to provide information. There's an exclusion, that they're asking too many questions. So the idea that digitisation is going to make it easier for service users and carers is quite problematic, I think. And the only other point I want to say is that I think agencies want to use digitisation in terms of how it benefits them, but we don't seem to have enough data around ethnicity, religion, age, and it means that we can't deliver services. We can't see where people are being lost. And I just looked at the data produced by the government for 2019, and there's been an increased number of BME service users coming into hospital, and yet the data is kind of a bit weak. We've got big sections where there's others. We don't know who the others are. Some trusts are not even recording information. So we have asked under the Freedom of Information Act within AWP to give us the data, but they don't have the data. So I think we need to, I'm not saying digitisation isn't important, but it's about who's being carried along in this kind of discussion. And it's definitely not people from Black and ethnic minority backgrounds. That's my view.
Okay, thank you very much for that view, Zakira. It's very, very powerful. I would, if we had more time, I'd invite people to respond, but I know we've got two more people that want to ask questions or make points. The first is Peter Edwards. And I know that Caroline, you've got your hand up as well, so we'll come to you next. Peter, would you like to unmute and say what you want to say? Hello.
Thank you. Good. Yes, hello. This has been a really useful debate, and I think there's a tremendous opportunity with this. But you see, I come from a position of considering the mental health system to be completely broken. And when you digitalize something that's broken, you can actually make it considerably worse because everybody falls into those little boxes. But let's face it. I mean, I had a client yesterday in Manchester who called the police to his home because he was poorly. He was tasered to unconsciousness and taken to a private hospital in London under Section 2 of the Mental Health Act. That was the nearest bed they could find. Lots and lots of poorly people are left out in the community because there aren't the beds or the facilities to provide them with the help and support they need. So I think, it's very difficult to see how moving forward on digitalizing can really happen until you get a coordinated mental health service and perhaps try to dilute a little bit the arrogance of some of the psychiatrists that I come across. Sorry to say that.
Okay, Peter, thank you very much for your perspective. Caroline, would you like to unmute and either ask your question or make your point?
I just wanted to basically say that I've really listened to what Steve and Zakira have raised today, and obviously sort of recognizing my clear and obvious privilege, white privilege. But I wanted to kind of say that as CQC, well, from my perspective anyway, we've thought really, well, we've been trying hard since I've been in the role, which is sort of the last 5 months, to think about how we do get better at both sort of collection of data and standardization, I guess, of the way data is reported into us, to try to make some inroads into, so it's a tip of the iceberg thing, I know, but to try to make some inroads into better use of all of that data we have out there on ethnicity, to hopefully the end result is make the system improve the system and make it more equal. And I think as CQC we have a really important role to play in all of that, and I don't want to let that drop. And I know that point was probably not very eloquently expressed, so I apologize, but I just want to say I've heard what you're saying, I suppose.
Thank you, Caroline. It was very eloquently put. We're going to go to Constantina next. Would you like to unmute and make your point, Constantina? I hope I've said that right. Constantina, you have your hand up in the box, which tells me that you want to make a point or ask a question. You just need to unmute yourself to do so.
Is that okay now?
That's brilliant. Thank you.
Okay.
Hello.
Hi. Well, I probably am one of the 2 or 3 service users on this Zoom discussion. And I mean, going back to what Zakira asked, where are the excluded ones? Well, probably fighting their mental health crisis at home with no support or on a mental health ward. And I mean, you know, who got the idea that digitalisation is a main priority for mental health service users at the moment, when, you know, particularly during the pandemic, people were left with no support because of the stripping down of mental health services. People were left without food, and people actually suffering. I mean, why is the digitalisation a main priority for service users? And a lot of us actually want the Mental Health Act abolished, or, transformed in a way that wasn't transformed as a result of the Mental Health Act review.
Thank you, Constantina. So that's a real throwdown challenge to some of the people in the group today about why do we need digitalisation? Would anybody want to respond to that from the panel or anybody else in the group? Oh, actually, we've got someone else who's put their hand up. Yes, Steve, I'll come to you and then I'll go to Asif, who's also got his hand up. Steve, take it away. You need to unmute. That's great.
Yeah, I mean, it's a very good challenge. I think this is one piece of work amongst a whole range of other issues. The Mental Health Act review didn't go far enough for some people. I understand their frustration around that. But when we looked, and we did a lot of work around service user and carer involvement, we had a real split. So we had a split between people that said, no, the Act should not have been used under any circumstance. But we also had, it was literally about a 50-50 split of people saying it was the right thing to do. But overwhelmingly, people spoke about how bad the experience was, and the fact that it was so poor, and I can attest to that, and I think we do have a real challenge to think not just around the Act, but actually how do we prevent people from getting to that level of unwellness in the first place, that we even need to consider using the Act. So there is a lot for us to discuss, and I hope that this type of discussion and this type of forum can give us the space to have those conversations, because I think that is something that is sorely lacking.
Yeah, well said. Okay, we'll go to Asif next, and then I can see Julie's also got their hands up. And we'll try and squeeze a couple more in before we complete the session. So Asif, would you like to unmute yourself and just make your point? And if it's in reference to something somebody else has already said, that will be helpful too.
Hello.
Hello.
It's really about Mental Health Act assessments and how we do them. I am a real live amp. Okay, I do Mental Health Act assessments. Guy touched about this at the very start. There is a lack of legal literacy about how these things happen. I'm not against the digitalisation of the forms, anything that makes it easier, but it's a side issue for me. Waiting, disparity of esteem, and a dysfunctional system. Okay, amps are not supported to do the job that you think they're being asked to do. We're going to people's houses. There's no bed. You're sitting for days, weeks sometimes. Med recs are running out. Okay, we do, in my area, we do 1,000 136s every year. 1,000 of them. That's what we did last year. That's 1,000 people have been picked up by the police. You know, there is other stuff going on that needs fixing by the CCG. I've spoke to CCG commissioners. The Mental Health Act. They've never read the Mental Health Act Code of Practice. If we did these things the way we're supposed to, and we're commissioned to do it, the experience, Steve, would probably be better. It's never going to be nice, but actually, And most people, I think the review identified, Steve, that they accepted at the time it was required, but they wished they were in some sort of way. Going to somebody's house, doing a mental health act assessment and making the decision to detain them is an awfully difficult one. Practically doing it, I suspect there are people in this conversation that have no idea what that actually looks like. Come to my house and make me go to hospital. I dare you. You know, what do you think happens? What does it look like? What does it feel like? It's like it happens in a Bermuda Triangle. And the question about, I'll bring it back to the digitization of the forms. Who does that suit? Okay. The only people I can think it suits is the first doctor, who thinks they're going to do a medical recommendation based on some sort of video conference phone holding thing, while me and another, somebody else, another do the dirty work. You know, it's nonsense. And the law doesn't allow for it. As far as I'm concerned, the law doesn't allow for it. Section 11.5 talks about personally saying.
I think we just need to try and squeeze.
12.1 talks about personally examining, to very ordinary English words. There may be some room around CTOs about video conferencing, but when it comes to infringing people's human rights, taking them away and detaining them under the Act, we are going to see them and have the decency to have the conversation with them face to face, pandemic or no pandemic, because that's what the law requires.
Okay, Asif, I'm going to stop you there. Can I just stop you there? I can hear you.
You might be able to wear a mask to do that. You might be able to justify doing that over a conference.
Okay, we've just muted Asif, partly because he's coming in and out, and also we have other people that want to say things before we finish, and we move on to Arden.
I've banged on and been muted, haven't I?
No, you haven't. Your signal was going in and out as well, which didn't help. I want just to come to Jilly, and I know we've got just minutes left, Jilly, so if you can make your point really quickly, I'd really appreciate it. Thank you.
I just wanted to say that digitisation for me is about having the voice of the people at the bottom heard. So for me, digitisation is about the person. It's not about our professional roles. And as a social worker, I see it as an integral part of my job is to support a person through the system, to empower them and to redress some of the power dynamics. And so I would want to see digitisation framed in that sort of way, as opposed to cutting corners, making it easier for people to get their paperwork in the right place.
Thank you, Jilly. That's really clearly put. Andre, have we got time for one more person?
Of course.
Yes. Becky, would you like to unmute and just make your point, and then we'll finish up the session, sadly?
Yes, I'll be super quick. I think just reflecting that digital, when it is done well, really gives people the information to make those really difficult decisions in terms of the Mental Health Act. The Mental Health Act is a big decision to make, I think, in terms of clinicians on the ground. And I think if we can help them by providing information on the person's, say, advanced wishes or decisions about their care, or as well, just, I guess, bringing in that care journey. So you have greater availability over where are beds available. So how can you speed up that care pathway? How do you make it more personalised? But yeah, stressing very much when digital is done well.
Thank you, Becky. So before I hand over to Arden, I feel I just need to just very quickly thank everybody for their contributions. There were so many good points made today, both in terms of challenging the concept and the operationalization of digitisation, but also some really good constructive feedback. Clear passion around the broken system and are we digitising something that's actually already broken. Very, very important points about inclusion of excluded people in any process that is undertaken to take this forward, and some very clear stories and pictures, if you like, of what it's really like enacting MHA out in the community. And then finally, really helpfully, I think that we should be trying to keep the voice of service users at the very centre of this debate and how it evolves. Arden, I'm going to hand over to you to do some concluding comments because we have reached our time of finishing for today. What would you like to say?
Thank you is what I'd like to say. First and foremost to everybody. I'll get onto it in one sec. I was quite keen to just quickly pick up on the last three comments. There was some consistency in what as if Anthony, Zakira and Konstantina said there, the priority I don't think should be digitisation. I'm the CEO of a technology company, of a digital company. I do not think the priority should be digitisation. What I believe, and I don't think, bluntly, we should be doing it for the clinicians either, to make their lives easier. They have very hard lives. They work very hard. Everybody involved in this is not sitting back, coasting by any stretch. They work very hard. However, I don't think we should be doing it for those reasons. I think the potential of technology is to enable a lot of what has been said today, but how we do that is far from clear yet. So I think there is an opportunity from technology to provide data, and I think that data can inform decisions. I think it can help us to understand why we have a massive overrepresentation of Black young men in services. It can help us to bring people into a decision-making process. I don't believe it should ever be used to make the process less personal. And in that environment, if you're coming into my home, I agree with you, Tony. You try and take me out of this home, you're going to have a hard time doing it. But if you can move the kind of legal process into the background by making that component simpler, I do think we can have to potentially improve that human interaction. However, there are a lot of challenges ahead of us, and certainly from my point of view, we have to listen, and we want to be involved in this debate and continue to do that. And I like being told that we're wrong. That's my favourite thing, because then we can react to it. And so I'd love to, any feedback that you give from this will go through Andre and the mental health. For me, it's been really just a wonderful session. So thank you ever so much, particularly to our panelists, because they've given up a lot of time beforehand to get ready and prep for this. But to all of you for giving up a couple of hours of your hot Friday when you could have been in the garden, if you have one, or in the park if you don't. And just say thanks ever so much. Really do appreciate it.
Thank you, Arden. So we're going to close the session. And we'll keep all the chat box contributions if you didn't get to speak in the large group. They're very, very helpful and informative. Andre, is there any sort of procedure we need to do to finish the session, or is it literally people who just are able to leave now?
Just to say, the chat will be saved, and we'll send that to you afterwards in the post-event blurb. We'll also send you a link to the YouTube video. We live streamed the last 50 minutes or so of this, so you can watch that again and see how wonderful you all looked and the brilliant things you all said. And yeah, thanks a lot for the contributions. It's been really good meeting everyone.
Okay, you have permission to go. Thank you so much, everybody. Bye-bye. Yes, the Zoom wave. And the panelists and the team are just staying online just to do a quick debrief. So if you can hang around, that would be great.